about 70% of Zambians are poor, and by and large, most of them are in the rural communities.
Well, this is one of the world's poorest countries. It's a very large country with a relatively small population. So it's difficult for any government to reach its population.
Okay, the Child Health Week program is designed to reach, especially the hard-to-reach areas, where in particular, because of the difficulty in getting to these areas, you find that most of these services being offered during this time are not available during the normal routine time. So the Child Health Week tries to explore and exploit this time that we reach all the areas, the rural areas of Zambia, and give the opportunity to the children in these areas.
Zambia is covering, I think, over 700,000 square kilometers, yes. And it has a varied array of landscapes ranging from mountains to valleys to all sorts of landscapes, sandy terrains. So, well, I guess that also adds to the challenge of us reaching these children wherever they may be.
Twice a year, 3 district health workers and their orderlies make the 5-day, 150-kilometer trek through some of the most hostile terrain Zambia has to offer to visit 4 isolated villages, all in order to deliver child health care services, including immunization, growth monitoring, vitamin A supplementation, and other vital interventions. This is the story of their journey. Zambia is a large, sparsely populated country of over 11 million people found in South-Central Africa. It consists of 9 separate provinces, including the Northern Province, which is where Mpika, the largest district in Zambia, is located. At roughly half the size of Austria, Mpika district is a difficult area to cover. And it is here in Mpika that this team of health workers walk across the Muchinga escarpment to deliver Child Health Week, an example of what UNICEF calls Accelerated Child Survival and Development, or ACSD, UNICEF strategy for greater child survival.
Child Health Week is a moment, happens twice a year, when a multitude of actors come together under the direction of the government of Zambia to deliver health services to children and mothers who might otherwise never have access to those health services.
So during this period, basically what we do is to mobilize all the partners, that is government, the other line ministries, the civil society, cooperating partners, the business community. So everybody who is concerned about the child, will bring them together.
The Child Health Week means that we, or government, call every parent, mother usually, to bring their under 5 years of age child to a health clinic during that week and bring their health card.
Child Health Week is an activity that provides an opportunity to receive either vitamin A supplementation, deworming services, immunization services, health education, and we also include mothers in these services with provision of family planning and health education. We provide vitamin A supplementation, deworming, and others. So an opportunity is provided to children to receive vitamin A supplementation, which is important for their growth, for their development of cognitive function, immunities, and also growth monitoring, which is very vital. We're also able to follow up on that. And actually, all these services that we provide during Child Health Week are important for child survival.
As the team continues their journey, they will have to carry packs of over 30 kilos of provisions, as well as equipment and medical supplies for the women and children awaiting their assistance across the difficult, harsh terrain. In 2001, it was estimated that there were 95 infant mortalities for every 1,000 live births in Zambia, with a further mortality rate of 168 for every 1,000 children under the age of 5. Diseases such as malaria, diarrhea, respiratory-related illnesses, as well as HIV and AIDS and endemic poverty have clearly remained significant obstacles for Zambian development. It was for these reasons that UNICEF and the government of the Republic of Zambia collaborated in 1999 to begin what would develop into Child Health Week. As the expedition moves on, the team is becoming fatigued in the hot sun. They must hurry to reach their destination before sundown, or they will be forced to spend the night on the mountain. After 35 kilometers of hiking, they approach the village of Kamwendo as daylight is quickly passing. Tomorrow will be a long day of healthcare delivery and more walking. Daylight sees the beginning of implementation, and the team works quickly to ensure everyone has access to the services. This program is an end component of the Accelerated Child Survival and Development Program, which, as explained by Dr. Tesfaye Shifaro, is a 5-point strategy for childhood survival.
We work to scale up high-impact interventions which can impact on mortality, morbidity, sickness and death reduction heavily, because there are technologically very sound and feasible interventions currently, but they are not reaching those who need most. We also work through generating evidence, the kind of evidence that needs to be replicable from around the world. We bring in here and then we replicate those evidence areas. We also assist in measurement of, we monitor and evaluate what's going on, because that helps to learn progress and to plan better. We leverage results through partnership. We also leverage finances, funding. We have our budget, but that budget may not be enough fully to address all the challenges in the country. So when we partner for resources, we also partner results. We have the technology for alleviating all the challenges facing children and women. But because we do not communicate very well, this service are not reaching those who need most. So we do a lot of advocacy related with high-level government in all its efforts.
With the morning's work completed, the healthcare workers say goodbye and begin the next leg of their journey, a 17-kilometer walk to Isaki village. They must hurry as there is much more work to be done and hours of daylight are rapidly passing. As they make their way to Isaki, the team struggles over the difficult terrain, taking care with each step as they move forward. However, they forge ahead and keep moving, much like UNICEF's ACSD interventions. Every step carries the potential of another life saved. After 5 hours of trekking, the team approaches Isaki and makes their way into the village. They stop for a short break as they are exhausted and still have a great deal of work to do before setting camp. One significant challenge of the journey is the team's cold chain provisions, as the immunizations need to be kept cold throughout the trek, or they will lose their potency. Fortunately, upon close inspection, they are in proper and safe condition. For the second time today, and despite their exhaustion, the team gets to work. As Paul Muma explains, it takes a special kind of person to do this job.
The first trip I made was in 03 to this place. The terrain of this place, it's hard to reach. So when climbing the mountain, you find that your muscles are exhausted. Even the water which you take from the streams, if you don't have things to purify your water, you risk getting diarrheal diseases. It's also another challenge. If I don't do this kind of a job, it means people around this place will just die just like that, without any help from anybody. I'll never get tired of coming to this kind of environment, just because of the heart that I have for these people. And I was trained to do this kind of job, immunizations, prevent diseases. So I just like the job that I do. I like it.
As night falls, the team takes a moment around the campfire to enjoy a few songs and take in the day. The festivities won't last long, however. Tomorrow brings another hard walk, as well as the task of delivering health services to hundreds of children and mothers. At daybreak, the team takes a cup of tea and enjoy their breakfast as they prepare to move on. The sun is rising quickly, and it promises to be another tiring day of walking. They begin their walk at a frantic pace. They have 2 villages to get to before nightfall. The only solace they can take at this moment is that their packs, some weighing over 30 kilos at the beginning of the journey, are quickly getting lighter as they consume and distribute much of their supplies. As they enter the village of Mutumba, Lucky, the Zambian Wildlife Authority officer assigned to protect the team from poachers and wildlife, unloads his rifle. There will be no need for it once in the safety of the village. In the village, the greeting is warm and the head woman is happy to see them. Healthcare services in this region are scant and are always welcome. The team is tired though, and Paul's muscles are sore. One boy looks on, and it is clear he is in desperate need of medical attention as his face is swollen with an infection. The team will have to make time to attend to him. Presently, however, the normal examinations have started, and Paul begins to register babies in his ledger for their growth monitoring. This woman, however, has yet another problem. Her hand was cut only last week, and the infection has rapidly grown to be life-threatening. As the team lances the infected wound, the pain is terrible. The infection is worse than anticipated, and the woman may lose her hand, a procedure not possible in the village. The team strategizes as to how the woman might be transported to the nearest hospital, some days' journey away. The woman continues to suffer, and now the boy is in no better shape as the orderly works to drain the infection that has blinded him. He too experiences great pain during the potentially life-saving procedure. Finally, and much later, the boy is feeling better. He's had his wound dressed, and his chances of survival are significantly better. As for the woman, the team has arranged for her to be transported to the nearest city of Chipata, where hopefully her life will be saved. Upon completion of their work and having provided as much assistance as possible, the team is moving again, as they have another 30 kilometers to walk before arriving at the final village of Chitala. But as Dr. Penelope Kalasha Muzumbu stresses, although the road is long, the duty to serve is urgent.
We do face challenges in implementing Child Health Weeks because this is an activity that is supposed to reach every child in the country. It is one strategy for us that is key, and we want to ensure that it continues being implemented. It is our responsibility to ensure that the vitamin A supplements, the deworming tablets, the vaccines, and everything else that is needed is actually in place, and we are the ones who coordinate that. UNICEF has been one of our key partners, and through UNICEF, or rather with UNICEF, we do plan together to actually ensure that Child Health Week is a success. So when we go out flat out to actually provide services through Child Health Week, we're ensuring that even when the routine has not worked so well for us, the children still have an opportunity through Child Health Week to be able to receive services, and this will enhance their health.
The team has arrived at the last village, and work starts again. A large group of mothers have come to meet them, and yet again, need for the services is great. The expedition has been long but successful. It is one of many contributions to Zambia's Child Health Week, which has become a shining example of accelerated child survival and development. Recent evidence shows remarkable improvement in child health, with a 26% reduction of infant mortality and a 29% decrease of under 5 mortality rate. But there is still a long way to go. As Dr. Victor Mukonka points out, this is a marvelous achievement for Zambia's Ministry of Health and its partners.
It's through the Child Health Week that we're able now to get all the vulnerable groups and be able to provide the service even to areas where we would have not reached. As a country, we have seen a complete decline in the measles cases in the country, and the last 3 years we had not recorded any deaths from measles. We have also seen a decline in tetanus, and we have also been certified polio-free country. Apart from that, our recent Zambian Demographic Health Survey results have shown a major reduction in child mortality. That's the under 5 mortality reduced from 168 to 119 per 1,000 live births. We have also seen a reduction in infant mortality from 95 to 70 per 1,000 live births. We have also seen a decline in terms of vitamin A deficiency from 65.7% to 53.3%. We still haven't reached where we would want to be. The figures are still quite high, and it's important that we work together if we are to succeed meeting the Millennium Development Goals, that we combine, if anything, double our efforts.
The next morning, the exhausted team begins their final 20-kilometer journey as they make their way back across the Muchinga escarpment. It is clear that their efforts in the valley have saved lives, and that this winter's Child Health Week has indeed accelerated child survival and development in Zambia. Tired and weary, but justifiable, proud of their efforts, the team head home to continue their work.
Child Health Week is an activity that, as an individual, I would love to urge whoever is responsible to be going strong. What I mean to say is, let whoever is helping the children in this valley or elsewhere worldwide to be focused, because we know the health of our children today is the prosperity of every nation in this world now.
If Child Health Week is not there or can be stopped, we may see to it that we are fighting a losing battle in terms of childhood illnesses.
But I think it's a worthwhile activity to do, because in doing that we prevent disease and we promote health for our children.
So Child Health Week is a very good instrument for universal reaching of children of all socioeconomic strata. It breaks the barrier of poverty, breaks the barrier of access, goes to every household, every community with high impact and evidence-based interventions to save lives.
We know that Child Health Week works. We know that mothers bring their children to the clinics during those weeks. So we need to expand them and understand, work more on what can we provide them with. If they're in a line anyway, why only provide them with measles vaccine and vitamin A drops? We could do more.
It is important in that we capture a lot of children. For example, usually we target about 2.5 million children, and we get to the levels of 90-96% turnout.